Have you ever given up, especially when you are on treatment on a certain medical condition? Welcome back to this channel where we talk about the basics of medical information making a difference in our lives. Kindly, if you are here for the first time, consider to subscribe. And for the returning subscribers, thank you so much for your support. Let's keep learning. Many times we give up because of the gap between where we want to be and where we are at a certain time. Let's take an example of a medical condition which mostly it affects everyone, but mostly it affects young children, what we call atopic dermatitis. Atopic dermatitis or eczema affects mostly young children. Most of the time, this condition worsens with the time. And you find that you're going to use medication for quite some time. And these medications, some of them are expensive. In the middle, you find that you're giving up, either because of the finances, you'll not be able to get the medication to use for the duration you have been told by a specialist, or the condition itself. Either you have used the medication and it's not improving at any time, but something can make a difference. And what is this? It's realizing of what you want. Of course, here you want the best results. You want the eczema to go away. So one thing you should do is to make the right action. The right actions here, mostly when you are given the medication has been dispensed, you are told, apply this in the morning or in the evening for this duration of time. Come back again for evaluation. But how often do we do that? Some of the people give up on the way. And I'm saying this because at one point I've come across some who have already given up, especially on their children. They've been given medication. They have done or used the medication for some time. The condition is not improving. They change from one doctor to the other, given maybe the same medication or different medication. In the process, you give up for the condition, which actually will not get us to where we want to be. That is why we are saying the gap between where we are or where you are and where you want to be, actually, it's very important. Where you are can change. The condition can keep changing, worsening. Now and again, using the medication, not getting the positive results, but where you want to get will never change. How comes then we don't get what you want? Especially when it comes to our health on medical conditions. One point is it's because we don't believe that we deserve whatever you want. We deserve good health. We deserve to get well. Do actions. And believe me, you will close the gap. You will reach there. You will get whatever you want. So any medical condition needs to put effort. An example, you get an infection like H. pylori. H. pylori treatment mostly takes like 2 weeks. When you are given the medication, you are dispensed like take the medication in 2 weeks. After 2 weeks, maybe you come back for an evaluation. Maybe you are given a proton pump inhibitors, PPIs, which are very good in healing tissue damages. You are told again, go and take for like 3 weeks or 4 weeks. But others, they give up on the way, meaning where you want to be will be very difficult. Another thing we should remember is nothing comes easy. Be it your health, be it whatever you want in this life, you should put an effort. You should exercise by doing the right thing. So, blame games are not good. First, do the right thing. Assess yourself. Have I taken the medication the way it's supposed to be? Have I taken it the duration which was given? I avoided whatever I was told to avoid. Many of us, when we are told avoid something, maybe a certain meal of which a certain type of food which you really like. So when you are told to avoid for some time, before you even start, you don't see the possibility of you avoiding. So in other words, you give up before you start. How do you give up before starting? So it's a challenge to me and to you also. Let me take an example. There are those who take alcohol. You are told avoid alcohol for this medication to work because we have what we call drug interactions sometimes. Avoid this or avoid alcohol for like 5 days. When you mention that, because it's something I've seen it, some people say it's better I avoid this medication for some time. And then how will you avoid medication? This is a condition which needs to be dealt with in 5 days' time. Or when it approaches a weekend, there are those who don't really want to hear that kind of. There are those who ask if there is something to be avoided before they start, of which is good. But it depends with your motive. Does it mean there is something you cannot really avoid for the sake of your health? Remember, where you want to be will never change. Where you are can keep changing, meaning you can move from one health facility to the other, looking for the right doctor or hoping to get the correct diagnosis of a certain medical condition which has not been really diagnosed. You can use finances, yes, but remember where you want to be. Whatever the end results will still remain, which means you want to get well, you want to keep fit. We should avoid giving excuses. You are told do this by a doctor, but on the other side, you have already answers you give. How can you get well? Remember, the treatment period is very important. Very, very important. Nothing comes easy. There are those who know that medication you are supposed to take in the morning and the evening. No, not every medication is taken twice a day. Up to this point, I believe we have gotten something which will help us make some changes in our health conditions. And remember, the gap between where you are and where you want to be is very important. The space in between is very, very important. The treatment period is very important. If you're told to do this, do that. If you're told avoid this, avoid that to be. That one will depend on what you really want at the end of that treatment period. There is nothing you can skip. There is no shortcut sometimes in the medical conditions. With medical conditions like fungal conditions, tinea capitis most of the time causes the hair loss in, yes, even in young children. When you look at your child and you see maybe the head, there is no hair at all, you give up before you even start the treatment. So there is no shortcut. If you are told take this medication for this duration of time, all you will have to take this medication for quite some time so that we evaluate. If you give up before you start, that will not really help you. It's better to have a positive mind. The medication may not, at some times, may not respond well, and the doctor has to change the medication. Be positive. Sometimes, yes, we struggle to get the finances to get the medication. Even the dosage for completing a 7-day dosage becomes tricky, but don't give up. Let's really think of what you want. What do we deserve at the end of a certain treatment period? The gap between where you are and where you want to be will determine the response. Thank you so much for always checking on this channel. Let's get the information. There is nothing which gives me peace or makes me happy when you have the right medication or when you have the right information. Each and every one of us needs good results at any time, any point you want to do something. The same thing with our health. When you want to keep fit, you should be consistent. You should do the exercise. So if you give up on the way, remember, you not get good results. Want to lose some weight? Remember, there is no shortcut, no excuse. You either have to wake up very early in the morning and do the exercise, or late in the evening go to the normal routine. That one will really determine on the end results. Thank you so much. Let's keep empowering each other. Let's keep sharing the information in the comment section below. You can give us your experience. Have you ever experienced this? Have you ever given up at some point for yourself? No, we should not give up at one point. Remember, whatever we do will determine the end result. Thank you so much, and let's meet in the next video. Bye bye.